In this session, we are going to see the different types of options that are available to the dying patient. We will also see what is the different management techniques that are today being employed in order to take care of the dying patient, and also explore some of the core principles of managing the dying. We will also see the different options that are available for the dying patient. To begin with, let us start the different criteria that influence management of the dying patient. For example, it all depends on how of dying, where of dying, and who of dying. Coming to the how of dying, management of the dying patient depends on what disease condition that the patient is suffering from. For example, research results showed that what diseases earlier people were dying of are completely different from today what they are dying of. You can see the results that are given. In 1900, Brim et al. In their research have shown that the top 5 causes of death, and they found that influenza and pneumonia topped the list, followed by tuberculosis, then gastritis, and then only heart disease and stroke. But whereas in a recent research study, Minnow and Smith has found that the top 5 causes of death in the year 2000 are heart disease, followed by cancer, then stroke and COPD, and finally accidents. So, depending on the type of disease that the dying patient is suffering from, certainly management varies. For example, if it is to do in the case of pneumonia or TB, then care of the patient will involve taking care of the wounds of the patient, and also seeing to that this patient is segregated because these are infectious diseases. And also the treatment places will also be placed outside the city because they are communicable diseases. But whereas today's top 5 causes of death are not infectious based, like the case of heart disease, where here the patient need to be closer to the hospital setting, and also say for example in ICU units, the heart patient can be treated along with patients suffering from other diseases. So, the kind of problem that the patient is suffering from is influences the kind of management that the health professionals have to take care of. Another important factor that influences management of the dying patient is where people are dying today. Earlier people were dying more in their homes, but whereas today the place has shifted more to the hospitals and the nursing homes. In the graphical representation of the pie diagram, you can see where people are dying today. And in this pie diagram, you can see that about 57 of them are dying in the hospitals, and 17% are dying in the nursing homes, and only 20% of the population are dying in the homes. So, if it is at the homes or if it is at the hospitals or nursing homes, especially old age homes, then the kind of management certainly varies. Another factor that influences the kind of management of the dying patient is who is taking care of them. Research results showed that the caregivers for 35% of them are the children, and in about 30% the top caregivers are the spouses, and only in 9% of the cases the caregivers are either parents or sibling. So, who is going to care for the patient is also an important factor. For example, if it is mother is caring for a grown up son, now naturally when things like dressing and other important functions have to be taken care of, then certainly they have to involve more nurses. But on the other hand, it is a same sex member who is acting as a caregiver, then more involvement of the caregiver can be managed. Let us see what are the core management principles of the dying patient. Now, the healthcare professionals looking after the dying, they have to show respect and to the dignity of the patient as well as to the family members or caregivers. They should also show sensitivity to the patient and the family and also the caregivers. Apart from that, they have to ensure that they are giving proper interventions in order to reach patient goals. For example, since they are the dying patient, being alive is no longer the goal, but seeing that they are in comfort is one of the patient goals. And the healthcare professionals should also take care to see that they have enough knowledge to alleviate the pain and suffering of the dying. Another core principle is to see that they respect the decisions of the patient and the family members regarding when not to agree for a treatment method. The healthcare professional should be aware that the patient and the family have a right to refuse treatments and they have to behave accordingly. Coming to the psychological, social and spiritual needs of the patients, the healthcare professionals should ensure that they assess these needs and not only that, take care to manage the needs, and in case they are not capable enough to take care of those needs, they should at least refer to the proper professional. For example, a dying person might have some spiritual needs. So, at that time, depending on the spiritual background of the patient, the healthcare professional need to refer to say a clergyman or to a guru and so forth. Coming to the other core principles of management of the dying patient, the healthcare professional should also keep open the research possibilities and they have to encourage and cooperate for professionals doing research. There is lot of research that is done to identify what really dying patients want, that is what kind of care that they would prefer. You get the results of Singer and his associates who pointed out 5 important components of quality end of life care, and of the 5, management of pain and symptoms topped the list. And the second one that the patients really look for is avoiding inappropriate prolongation of dying. Third one is helping them to achieve a sense of control and then relieving their burden. And finally, the healthcare professionals also should try to strengthen the relationship with loved ones. Now, as Elisabeth Kübler-Ross says, there are 5 stages that a dying patient goes through: the stage of denial, the stage of anger, then the stage of bargaining, then the stage of depression, and finally acceptance. So, the healthcare professionals have to identify in which stage the person who is going to die is in and try to give appropriate interventions. For example, if the person is in the depression stage, then the healthcare professionals have to spend extra time trying to reassure the dying patient that this is a common phase and that they are also going to overcome that. And another challenging aspect is that not all dying patients go through the same stages in the same progression. So, it is even more challenging for the healthcare professionals in managing with these dying patients. They have to identify the stage that they are in, and many times these dying patients may not experience any of the stages. For example, take the case of a cancer person suffering from cancer, and if the person is diagnosed in the last stages when there is acute pain, then many times the diagnosis of death in fact makes the person feel relieved, and such patients will be looking forward to dying and so then it becomes quite easy for the management of such patients. And for such patients, the health professionals have to take care of their spiritual needs, and depending on the religious background of the dying patient, they have to recommend proper professionals to take care of them. Taking care of the dying patient also involves education of the patient as well as education of the family members. And we have already seen how dying trajectories help in educating the patient and the family members. So, if the healthcare professionals take time to spend with the patient and the families, discussing with them about the progression of the disease and also showing dying trajectories and discussing the course of progression of the disease, will make the patient and the family members, they will know what to expect. And also educating the family members and the patient will help clear their confusion, and it will also make them feel understood and being taken care of. Spending lot of time, especially in the initial stages, in educating about the disease condition and the process of dying will be very beneficial in the management of the dying patient. Management of the dying patient also involves what is the disease condition, the present state of disease of the patient, and also the kind of symptoms that the dying patient is showing. To ascertain the disease condition and also to see the level of activity of the dying patient, there is something called as activities of daily living scale. Using this scale, the healthcare professional can gather important information from the family members regarding whether the patient is able to get in and get out of a bed or a chair, whether the patient is able to use toilet, the patient is able to do bath on his or her own, and also the capacity to dressing up and also eating abilities. So, these will be identified, and basing on the activities, the intensity of the disease is ascertained, and also basing on these daily living activities scale results, the kind of management that has to be taken care of will be decided by the healthcare professional. You can see the graphically how it is shown, that is the adjusted proportion of people with trouble getting in and out of bed or chair. In here you have about 5 diseases, and you can see the red dots, that is the cancer, patients suffering from cancer. Initially there are very few people who cannot get out of bed or chair, but as the disease or as time elapses, there are more and more who are not able to get out of, that is, in other words, they are bedridden. But whereas compared with diabetes and other disorders, the patients are more or less in the same state. So, by doing such assessments, the healthcare professionals see what kind of treatment that has to be given and what to expect. For example, in this case, they know beforehand that a cancer patient in the initial phases, there is not much care to be taken of, but as the disease progresses, then the person is going to get bedridden and lot more care is required. And coming to the symptoms of dying, that is just before say 1 week of death, the patient will be starting to have various symptoms. So, knowing these symptoms also will help the healthcare professional to decide the kind of management that has to be taken, and also it will prepare the family members to for the impending death. Some of the symptoms that are listed are fatigue. So, when this is indicated, then the healthcare professional can bring in a respirator at that time and help the patient. Other symptoms are drowsiness or insomnia. Some people will feel very sleepy, and almost most of the day they will be sleeping, but others they will have very great difficulty in getting to sleep. And there will be also some sort of confusion on part of the dying patient, and of course there will be lot of anxiety, and of all there will be intense pain and suffering in many cases. And just before 48 hours before death, there are also certain symptoms that have been found out. That is, these patients will have orderly loss of senses and desires. To begin with, first they will lose hunger, and after that they will have loss of thirst. Actually, many patients will be wanting to sip some water, but what physicians say is this is not thirst, but it is because of dryness of mouth. So, there is loss of thirst, and after this one can see that there is loss of speech. After loss of speech, there is loss of vision, and finally, when hearing and touch are also lost, then it means that is imminent and it is very near. So, knowing these symptoms will help the healthcare professional to bring in or to start other medical interventions. Let us see what are the various institutional systems that are available to take care of the dying patient. The first one that is available is the traditional hospital, and the second one is palliative care. So, the traditional hospital system, the care begins with plotting the dying trajectories, and these dying trajectories are of three kinds. The first one is the swift death, which do not have lot of ailing, and there is death quickly happens. And the second one is the lingering while dying death, where slowly there is a degeneration and slowly the patient over a period of time finally dies. But whereas the third type of dying trajectory, that is the entry and re-entry dying trajectory, where for example people suffering from heart attack, they suddenly they get this heart attack and they are admitted to the hospital and their functioning level becomes very low. But because of medical intervention, they after some time of treatment, their functioning level is improved, they become okay, and then they leave out of the hospital. But after some time, it might take some months or even some years in some cases, they again get the attack when they are that is sort of re-enter and then they get treated, and this might go on for a couple of times. So, this is a third kind of dying trajectory. So, the hospital staff, depending on the dying trajectory, they try to give the kind of appropriate treatment to the dying patient. And this traditional healthcare system is curative in nature. That is, they try to treat the patient, and with all possible means they will try to help the patient to live as long as is possible. They either use medications or they use state of the art advanced medical procedures, they might use surgery, or they can combine all these three, and here the emphasis is on curing the patient and also to relieve the pain and suffering. Going to the next healthcare system that is available today is a palliative care. Palliative care is defined as any intervention designed not to cure, but to promote dignified dying. Now, when research is done identifying what are the fears of dying and death, researchers found that many people fear death because they fear a sense of loss of control before dying, and they also fear the what kind of condition they will go into. They might have seen many elderly people just before death, they lose control and they lead vegetative childlike life. So, in order as a response to overcome these fears, today palliative care will help dignified dying of the patient. And this palliative care includes three aspects. One is training the staff, the second one is modifying hospital structures, and the third one, which is increasingly becoming famous, is the hospice. Coming to training the staff, now the medical staff, they have to be specifically trained in order to deal with the extra challenges of treating a dying patient. They have to be trained especially for pain medication and relieving of suffering. Apart from that, they should also be trained regarding the ethical aspects that are involved in withdrawal of treatment. And the third one is they have to be additionally trained to how to communicate with the patient as well as the family members. Apart from that, these healthcare professionals need also to be trained on the cultural and religious backgrounds. So, they should have information regarding different cultures and different religious concept of death, so that they will behave appropriately with the patients. For example, if we take Muslims, they might indicate that they want to change the direction of the bed so that the head of the dying patient is turned towards Mecca. So, healthcare professionals should be sensitive and respond appropriately according to the dying patient and the family's needs. So, such kind of training is today given to the hospital staff in addition to their normal training. Going on to the next one, that is modifying hospital structures. As is said earlier, hospitals are curative based, but today they are also trying to identify the need to have a palliative care. So, hospitals today are modifying their structures and having a separate unit or ward for palliative care. So, here they have two different set of staff, one taking care of the curative needs of the patients and another the palliative care. Going on to the third system that is available today, that is hospice. Now, hospice started in the US in Connecticut in the year 1974. And this hospice kind of treatment is devoted to allowing the dead to occur in a safe and pleasing environment, and also to allow death to occur in a natural way. So, the hospice workers are also trained in taking psychological care of the dying and also the family members. And here in hospice care, bereavement counseling is also involved. So, it means that even after death of the patient, the hospice workers continue to work with the family in helping them overcome grief. However, deciding when to have hospice or not have hospice is a challenging issue, not only to the person who is dying and the family, but also to the medical staff, because hospice will come into effect only when the medical staff diagnose that this particular problem can no longer be curable. So, when they want to prepare the patient for impending death, and when they are clear that death is imminent and little can medicine do to help or relieve the pain or suffering of the patient, then only hospice can be recommended. And there are many issues that are involved in hospice, because some patients might want to die at home or some might decide to die in the nursing home. If in the case of dying in a hospital, there is potential for better management of the physical aspects of dying, because lot of medical equipment is available. As and when it is required, the medical staff can use those equipment. But if dying has to happen at home, such facility will not be available, or there will be delay in offering such facilities. And for the case of dying in a hospital, there is no fear of burdening your family with care, that is especially financial aspects, and also privacy to vent your own feelings without family members around is possible in a hospital setting. But whereas within the family, the dying patient has to continuously look at the suffering of the family members, and also they will have this fear that they are overburdening the family members if dying has to take care in a home setting. So, taking in mind or keeping in mind all these issues, deciding where to have hospice facility has to be taken care of. Coming to taking control of dying, people today can have what we call as advanced directives. Advanced directives are written documents with specific instructions regarding when to stop life prolonging treatments. So, these are usually legalized by a notary, and example of these advanced directives are do not hospitalize orders, for example, which are called DNH. So, when the patient prepares such an directive, then even when the dying patient's condition has become critical, even then the family is not supposed to hospitalize them. So, it is a decision that is taken by the dying patient not to get hospitalized. So, today we have many such written advanced directives, and another example is living will. One more example is having a power of attorney, where the dying patient will specifically identify a family member or a friend as the case requires to take care of decisions that are to do with whether to continue a life prolonging treatment or not. So, the patient might be having a doubt whether during the last days whether consciousness will be there or not. So, in such a situations, in advance only the patient can prepare this power of attorney and can designate another person to take decisions on his behalf. So, like that today there are more and more facilities that are available to help the dying patient to have some sort of control on the dying process. Apart from that, there is also this growing debate regarding can we take decisions regarding when to die, and that is the case of euthanasia. So, in this lecture we have seen how to manage a dying patient. We have seen what are the core principles that are involved in management of the dying patient. We have also seen the different institutional structures that are available today, that is either hospital or palliative care, and also the upcoming facility of hospice. In addition to that, people today are also able to make decisions when to die. In some countries, they have legalized people opting for physician assisted death. So, we can say that dying today is not as uncontrollable or as it was earlier.